Hi, I'm Donna Labrica-Talvo, and I'm an occupational therapist that works here locally. And I worked at York Hospital for almost 26 years, and now I'm working in private practice. Came to Dr. Jeff Donatello for a lot of pain, fibromyalgia pain, and participated in his program, and I feel fabulous now. I have a lot more energy, working out constantly, working toward my certification for my black belt, and I feel like I can do that successfully now. I'm very grateful to the program. Highly recommend it.
Hi, I'm Erin, and I'm from Wells, Maine, and I've been seeing Dr. Jeff for about 2 months.
Okay, and you had what, fibromyalgia is what they called it?
Yes.
Okay, and how are you doing? Tell me how you're doing.
I'm doing great, actually. I had fibromyalgia for about 5 years. The last 3 years has been really bad, and a lot of pain, the only relief from narcotics, and after being on oxygen therapy for just about a week or maybe 2 weeks, I was really starting to get rid of a lot of that pain. And so, yeah, I mean, I haven't been in very much pain at all. It's probably about 75% better than
So
it was
75%. So
Yeah.
so you're 75% better, and you've never been that good
No.
in 3 years.
No,
Okay.
not at all.
All right. So you're excited about it then.
Definitely.
All right.
Yeah,
Thank you so much.
absolutely.
Hi, I'm Dr. Jeff Donatello, and I'm the author of this book, Energize Your Brain, Change Your Life, An Introduction to Exercise with Oxygen Therapy. And if you're watching this video, then you or someone you know or love suffers from fibromyalgia. I've been utilizing chiropractic care for 15 years. I've seen over 105,000 office visits come in and go for all those years. And I used to treat fibromyalgia with chiropractic until I realized that I wasn't really helping people. Chiropractic alone will not help fibromyalgia. But over the last year, I've stumbled across what's called functional medicine, and we're getting incredible results with fibromyalgia. In many cases, your fibromyalgia can be cured. That's right, it can be cured. So I want you to watch this video, and you're going to learn a lot. And in the end, give us a call, and we can help you out. Thank you. I specialize in functional medicine, and in the next few minutes, I intend to open your eyes to a new way to treat fibromyalgia. I will show you how, if treated properly, fibromyalgia can be made tolerable. You can get your life back, and in many cases, you can be cured. Functional medicine is concerned with finding the primary cause of your pain and fatigue, not just dealing with the symptoms. More than likely, you've been to your medical doctor, probably more than one, probably to many specialists. And what they all give you? They gave you drugs. Drugs like Lexapro, Cymbalta, Lyrica, all powerful anti-seizure drugs. These drugs rarely work, and they only mask the problem. And worse, there's serious side effects and risk factors associated with taking them. Things like memory loss, problems concentrating, slow thinking, we call that fibro fog. You can become constipated, have speech problems, weakness. You can have an increased appetite, which puts on weight. You have problems walking, twitching. You can get vertigo, chest pain, depression. All of these symptoms just make me shake my head because it doesn't have to be like this. But what are you supposed to do? Because until this moment, you have never been given any other real options that work. Fibromyalgia has probably stopped you from enjoying certain aspects of your life. But life is short, and you deserve to be able to enjoy it to its fullest. So you're obviously looking for answers to your problem, and I want to let you know that our office is the place for those answers for people with fibromyalgia, and I can say this confidently. And that's because I've been trained on how to look for the cause of fibromyalgia, not just masking symptoms with drugs and send you on your way like the medical doctors have done so far with you. So, how did this all happen? Where did these problems come from? Well, for many, many people, in fact almost everybody, there's been a stressor of some sort in their life that led to this type of chronic condition. Either physical, mental, or chemical. And it's my job to figure out what is what and where this came from. When I say physical stressor, either a car accident, maybe a slip and fall, even repetitive stress where you possibly could be sitting at a desk for many months, many years in poor ergonomical condition where you're bent over. We can talk mental stress. Let's say, the recession, money problems, family problems, your health. Those are all mental stresses. And if it's not physical or mental, then a lot of times it can be chemical. There's a lot of environmental toxins out there, mercury, lead, things in our environment that weren't there 50 years ago, which is why people tend to have more chronic illness. So physical, chemical, and mental stress leads to chronic disease.
These things can and do lead to fibromyalgia symptoms, and conditions like pain, fatigue, insomnia, and depression all come with physical, chemical, and mental stress. And in short, stress makes you sick. So how do we find the cause? By being thorough. A large part of functional medicine is being an expert in metabolic testing. There are state-of-the-art lab tests we will have performed to determine the cause of your problem. Metabolic assessment checking for the following problems. Look for anemias. Anemias mean you don't have oxygen transport. If you don't have oxygen transport in your body, that's the way you have energy. And if you don't have energy, then you cannot function and heal. We want to look at your liver and gut function. We want to look at adrenal gland function. That's very important. Your adrenal glands should send off a certain amount of hormones throughout the day at a regular time. If that's off, you're going to be tired, have fatigue, and have lots of other problems. We want to look at blood sugar issues. If your blood sugars aren't balanced, if you're dysglycemic, or if you're pre-diabetic, we want to know that. Food sensitivities. There are 5 foods you have to rule out. And believe it or not, any one of these foods can be the cause of your fibromyalgia, and we can test for these foods. And also, if you have autoimmune disease, which more than likely you do, about 80% of people have autoimmune disease, especially if you're one of those people that have been to 50 different doctors and have a whole stack full of, your history full of notes and exams and lab work, then you're probably autoimmune. And that trumps everything. We have to treat the autoimmune disease, and there's ways to do that. These are all things your other doctors may have overlooked or just don't plain understand. We will leave no stone unturned in finding the cause of your fibromyalgia. And once we find the cause, we can narrow in on the specifics and actually treat what's causing your symptoms, not just treat the symptoms themselves. Whatever it was that got you to this point, the cause of fibromyalgia is brain inflammation. All the studies show this. And that's what functional and metabolic medicine is about, finding the exact cause of the inflammation and putting out the fire. You have to understand that the ladies you saw giving the testimonials earlier on in this video, they were once sick like you. Don't think for a second you can't get better. You just have never been treated properly.
So that's about it. What I want you to get out of this video is to understand that fibromyalgia is treatable. You can be helped. And I hope to be able to help you in the near future. Thank you.